Intermittent fasting, IF, has garnered significant interest due to its potential health benefits and flexible approach to 1. Weight loss and metabolic health. IF can help with weight loss and improve metabolic health by reducing insulin levels, increasing human growth hormone levels, and enhancing fat burning processes. 2. Cellular and molecular benefits. During fasting, cells initiate important repair processes and change gene expressions related to longevity and disease protection. This includes autophagy, where cells remove dysfunctional proteins and recycle parts. 3. Improved insulin sensitivity. IF can improve insulin sensitivity and lower blood sugar levels, which is beneficial for preventing type 2 diabetes. 4. Brain health. Fasting can increase brain-derived neurotrophic factor BDNF, brain hormone linked to cognitive function, and may reduce the risk of neurodegenerative diseases. Inflammation and heart health. Some studies suggest that IF can reduce inflammation and various risk factors for heart disease, including blood pressure, cholesterol levels, and triglycerides. 6. Longevity. Animal studies have shown that intermittent fasting can extend lifespan, although more research is needed to confirm this effect in humans. Verse 7. Flexibility and simplicity. Unlike traditional dieting, IF doesn't require constant calorie counting or food restriction. It focuses on when you eat, making it simpler and more adaptable for many people. Methods. There are multiple ways to practice IF, such as the 16-8 method, 5-2 diet, and the eat-stop-eat method, providing options that can suit different lifestyles and preferences. These points highlight why intermittent fasting is a popular topic among both researchers and the general public interested in health and wellness.